Welcome. I'm Mike Devo from International Medical Massage. My office is in St. Charles, Illinois. And this is another of our Stay Safe at Home series about self-help massage tips. And as I always preface each one, that this is not to replace a visit to your doctor or to your massage therapist. It's just some tips at home where you're not able to get out right now to see your health practitioner, and maybe some of these can help you in the time while you're waiting. So today we're going to talk about knee issues, specifically the Goose Foot area, which is per Senimus, or I can never say it, but we just call it the Goose Foot, and there's a reason for that. As you can see per this picture here, those three tendons, the sartorius muscle, the gracilis, and the semitendinosus, come and converge, all three right there, and they kind of look like a goose foot. So I have it labeled on my leg itself. This is a little more primitive, but so this would be the sartorius, and this attachment comes all the way up to your outside hip bone. The gracilis is a thinner one coming up the middle, and the semitendinosus comes up and attaches to your pubic bone. So all three of these areas also cover this bursa sac, which is underneath. So this is a prime area for tendinitis and bursitis of the knee. So many instances, a client will come in with knee pain, and I ask them where it is, and it's hard for them to decipher, and they'll say, like, it feels like it's inside the knee. A lot of times it's coming from this area or on the quad attachments itself. So these are two areas we will address right away. There's lots of moving parts in the knee, so there's lots of areas to look at, but specifically this area here causes a lot of issues, especially with that bursa underneath, and can get inflamed. So what you can do at home, I'm going to take this off since we know where the area is, and a good way to find it is right underneath your patella here. You go straight across and you'll feel that bony prominence there. That's where you'll find these three. So we're going to just remove that. And you can either take some lotion, or I have my little CBD oil here, and we're going to work that up. Always want to work up towards the heart, just to maybe bring out some inflammation. You can come all the way up here. I'm just not going to show you because it's a little hard with the pants on and everything. So, and then you can be a little more specific in that area. Just do some gentle friction along there. Don't overdo it. Don't ever overdo any of this. If it's really sore, just back off. But you can work all three of these across at the same time and try and relieve some tightness in that, underneath that bursa. And normally, if you're in the office, we're going to work that muscle all the way up. The Latin term for sartorius is tailor. So, of course, the tailor back in the old days would cross their leg and stitch right in this area here. So this is going to get a lot of overuse here. And again, that sartorius attaches all the way up to the hip. So it's going to affect your hip as well. So as we like to say, everything is connected, but in this instance, that's where those two connect. So either here or the same thing, you can work on these quad attachments. We have these huge, chunky quadricep muscles, and they all thin out to these attachments right above the patella here. So this is a good area to massage across as well. If you're having trouble going up or down stairs, typically, and not always, but these quadricep attachments are part of the issue that are hindering you from, or making it hard to go up and down those stairs. And even just doing this, sitting in a chair, when you flex like that, you can feel the tension in those quadricep attachments. Also, your MCL, your medial collateral ligament, is here as well. So again, there's lots going on this inside of the knee as well as the outside. And you can just generally massage both sides as well. And again, go up towards the heart, keep everything flowing this way. And it's something just a little bit before you're able to get in to see your therapist or your doctor, just to relieve some pain for the time being. All right, well, thanks for watching, and I hope to see you soon. Bye.